Good day everyone, my name is Altaya Barsana from BSN1 11H, and today I am going to perform a return demonstration for history taking and general survey. So history taking and general survey is in the simplest form that involves asking appropriate questions of patients or their relatives or carers to obtain information to aid diagnosis. It is identified as a core clinical skill for professional competence. Also, history taking is a staple essential backbone for making an accurate diagnosis. It will enable the clinician to make a provisional diagnosis in most of the cases. So the materials that we will be needing on this interview would include a bottle of alcohol for sanitation, a stethoscope, BP apparatus, and a thermometer for taking of the vital signs, and our comprehensive form where we can put all of the results that we will be obtaining later. So before doing the interview, it is important first that we do our hand washing and as well as sanitizing our hands. Also, we need to provide client privacy, safety, and as well as the setting of the interview should be safe for the patient. Now I am going to close all the curtains. And also, it is important that the setting of the interview must be safe for the patient. And now, we are going to do the assessment. Good day, sir. My name is Altaya Barsana po, and I am going to be your student nurse for today. And today, we are going to do history taking and general surveys. Is that okay with you, sir?
Yes.
Okay, so for verification po, before we start the assessment, can I know your name, sir?
Felix Barsena.
Okay, Felix. When is your birthday, sir?
October 22, 2007.
Okay, how old are you po?
15 years old.
How do you want me to call you, sir?
Felix.
Okay. So today, sir, as I told earlier, we are going to do some questioning. So what brought you to the hospital today, sir?
I have fever.
Okay, so can you tell me more po about the issues that you've been experiencing with your fever?
My head hurts and I have a headache.
Okay, so can you tell me where is the pain, or can you point at me po, where do you experience the pain?
Here and here.
Okay. So, did the pain come gradually or did it come suddenly?
It comes suddenly.
Okay. When did the pain first start po?
Yesterday morning.
Yesterday morning. So, how would you describe the pain?
It feels like my body is on hot fire.
Okay, so is the pain constant po or does it come and go?
It's constant.
Constant. Okay, so does the pain spread elsewhere aside
No.
from your head? Okay, no. So has the pain changed over time?
Yes.
Oh, yes. So does anything make the pain worse?
No.
Okay, so does anything makes the pain better?
Yes.
Okay, so what have you done po to ease the pain?
I drink tablets.
Okay, you drink tablets, that's all, sir?
Yes.
Okay, so on a scale from 1 to 10 po, how severe is the pain with 0 is no pain and 10 is the worst pain that you've ever experienced?
7 out of 10.
7. Okay, so let's move on po for your past medical history. Is that okay, sir?
Yes.
Okay, do you have any medical conditions po right now?
No.
Okay, have you experienced being hospitalized before?
Yes.
Okay, so have you ever been diagnosed with an ailment that is connected with your main health concern today?
No.
Okay, no. So have you experienced previously or previously undergone surgery or operations?
No.
Okay, no. Are you currently taking prescribed medicine or medicines that are over the counter?
No.
Okay, no. Do you have any allergies?
No.
Okay, no. Are you sexually active, sir?
No.
You are not? Okay. So now let's move on to your family history. So do you have any family members that have history of heart disease?
Yes.
Okay, can you tell me who is it, sir?
My grandma.
Okay. How about hypertension?
Yes.
Okay. Is it still your grandma, sir?
No, it's my aunt.
Okay. How about cancer?
No.
How about diabetes?
Yes, my grandma.
Yes. Okay. So, now I'll be asking questions po to check your lifestyle, psychosocial status, and your social history. Okay, sir?
Yeah.
Okay. Do you have traumas po, or did you lose any family or friends in the last 5 years?
No.
Okay, no. Okay, so what level of stress are you experiencing right now?
7.
Okay, 7. So what usually are the major causes of the stress that you've been feeling?
Schoolworks.
Okay, school works. So what are your coping mechanisms po if you have one?
I sleep,
Sleep
play games.
and play games. So what time do you sleep and do you wake up, sir?
11 p.m. and I wake up at 6.
Okay. So, when you wake up, do you feel rested?
No.
Okay. So, what is your occupation, sir? Or are you working or are you currently studying?
I'm currently studying.
Okay, studying. Do you wish to gain weight or lose weight?
I wish to gain weight.
Gain weight. So, do you exercise po? And if you do, what type of exercises do you usually do?
No, I don't exercise.
Don't. So, how many meals a day po do you eat?
3.
3. So, how often do you eat meat po? Like a week?
5 times a week or 3 times a week.
You gurno.
I go you then.
1, 2, 3. How often po do you eat meat a week?
5 times or 3 times a week.
Okay. So, what are your favorite foods, sir?
Chickens.
Chicken. Do you have foods or certain foods that you avoid to eat?
No.
Okay, no.
No.
So, may I ask po, sir, who else lives with you in your house?
I live with my mom
Okay, mom
and dad.
and dad. Okay, may I ask po, what tasks can you do independently?
Household tasks.
Household tasks. How about tasks that you cannot do independently and requires you to have an assistant with other people?
Lifting heavy stuff.
Okay, lifting heavy stuffs. Okay, so do you smoke, sir?
No.
Okay, no. Do you drink alcohol, sir?
Occasionally.
Occasionally. Okay. Are you currently or are you regularly seeing a doctor or a specialist?
No.
No. Okay. So you have mentioned, sir, that you have fever and that you are experiencing headache that just came suddenly. You have also mentioned that the pain is constant and does not spread elsewhere in your body and it doesn't have any changes. Also, you have mentioned that you don't have any medical conditions. Is that right?
Yes.
Okay, that you have been hospitalized before, but it is not connected with the same ailment that is your main concern today. You have also never experienced to undergone to procedures or operations, and that you don't have any allergies or you're not sexually active. Is that correct, sir?
Yes.
Okay. So you have also mentioned here in your family history that your grandma has a heart disease, your aunties has hypertension, and that your family has history for diabetes. Okay. So lastly, you've mentioned that you do not have any traumas and that you've been experiencing stress because of schoolworks, and your coping mechanisms are usually sleeping and playing games. You've also mentioned that you sleep around 11 p.m. and wake up 6 a.m. And whenever you sleep, like when you wake up, you doesn't feel rested. You've also mentioned that you are a student and you wish to gain weight and you do not exercise. Okay. You have mentioned that you live with your parents and that usually the things that you can do independently is like household chores, and the things that you cannot do independently, so lifting heavy weights. Okay, you do not smoke but drink alcohol occasionally. So are those data po or informations correct, sir?
Yes.
Okay, so now I will be transferring these informations po to the doctor so that he could assess it, and I will call you back later po. But before that, let me take po your vital signs first so that I could add this to the information so that a doctor could also review it, sir. Is that okay?
Okay.
Okay po. I want you to, sir, to lift your arms. Okay. Can I have your arm, sir? Can I have your hand po, sir? Hand po, sir. Okay, so now, can I touch your, sir? Just breathe normally. So, sir, your vital sign shows that your BP is 90/60 and your temperature is 36.5 and your respiratory rate is 17 beats per minute, and your pulse rate is 60 beats per minute, which is normal and a good thing. So again, sir, I am just going to give these informations to the doctors so we could review it for your result, and you will be called if it's all done. Okay, sir?
Okay.
Okay. Thank you very much, sir, for your cooperation today. And that's all. Thank you.